Hello, good evening. I'm Peta, Alleyne, and welcome to CBC Presents. Tonight, part 2 of COVID-19's impact on faith. We had a rollicking and healthy discussion, I think, last week. And we're back with our panel once again. Pastor Eric Peters, Senior Pastor of Power in the Blood Assembly, Principal of Codrington College, Reverend Dr. Michael Clarke, Bishop Dr. KENROY BURKE, who's the chairman of the Empowered Network of Churches. And joining us tonight, we have Mr. SULEIMAN BULBULIA, who is the Muslim chaplain at the UWI-Cave Hill. Once again, our panel will seek to help us navigate the ofttimes perplexing world of spirituality and faith, especially now it has been impacted by COVID-19 and the world of science. You can be a part of the discussion to share your thoughts, your experiences, your concerns. You can contact us by calling 228-5562 or 228-5563, or you can WhatsApp us, message only please, on 228-5562, or you can post your questions or your concerns on our Facebook page at CBC Barbados. We'll get to meet the panel once again this evening. Before, we do that, just let me say welcome to SULEIMAN. And on behalf of us all, I know that it's been a rough week for you, losing a member of your family. And I didn't want to let the evening go by before I had an opportunity to say that. And we're glad to have you join us tonight. So we will get to chat with our panel after the break. Last week, when we began the CBC presentation on this, I invited the members of the panel to just share their observations on that specific topic, COVID-19 and its impact on faith. Tonight, we're joined by Mr. SULEIMAN BULBULIA, and SULEIMAN, once again, our deepest condolences. And what are your observations when you hear the phrase COVID-19's impact on faith? What does that speak to you?
Well, peace and blessings of Almighty God be with us all this evening. And let me begin by thanking you, Peter, for giving me the opportunity to be here to join this distinguished panel of gentlemen and you, Peter, to discuss this very important topic of COVID's impact on faith communities. And I listened to the program last week. I watched it, and it was a very important program. I'm glad that you're having a part 2, and you're including someone outside of the Christian community into this, because all faiths have been impacted by COVID, all. everyone, and people without faith as well. So it's not unique to any one particular group. And I think the impact has been it's significantly on faith communities as well as a microcosm of the wider society. And we are feeling it. I mean, the Muslim community within the last few weeks have really felt it a lot. We have had about 4 to 5 deaths within our community within a 2-3 week span. And that has been a hard blow to us. We are a small community. We are a minority in Barbados. And so we recognize that this is it's not something that it's going to affect just a few people. It will affect everyone. And so we recognize in times like these, our faith teaches us that we need to strengthen our faith and build our spiritual health in times like this and turn back to Almighty God. And there's a verse in the Quran which speaks to that God will test us with fear and loss of life and hunger and poverty, but be patient and say from God we come and to God is our return. But that is what our thinking is and how we apply ourselves, and we try to apply ourselves to this impact of these challenging times.
Thank you. And gentlemen, since last week's discussion, we have had an opportunity to message one another, and I know that you each will have comments to share arising out of last week's program. So perhaps, Reverend Dr. Clarke, we can start with you, and then the others can share. And because there are a lot of us tonight, I think I might have a time limit, like put 2 minutes on each of us, because the discussion can get pretty wieldy at times. So please, sir, what are your observations arising out of last week's conversation?
First of all, good evening, and it's good that we're able to continue this program together. One of the things that were asked last week with respect to why do God allow bad things to happen, and I remember responding, quoting from C.S. Lewis saying that it happens to Christians because Christians and full of faith are the ones who can bear it. And someone had asked, so what does that mean? Why only Christians? And the answer really has to do with not so much the particular incident that is going on, but the preparation for the incident. People of faith from day to day are supposed to be building their spiritual strength for the opportunities in life that come and will come. And so it is not that they're more special than anyone else, but really and truly they're supposed to be doing the work of spiritual development, allowing themselves to let go of certain things in order that they may be able to respond to God's calling to a higher place. So when we say that only they can bear it, not because they actually that God breaks them out, but persons in any faith tradition who are doing the work of spiritual growth and development will be able to see it through any particular pandemic or life-threatening situation or serious situation. And seeing it through from a Christian perspective or from a faith perspective doesn't necessarily mean that one will stay alive. To see it through means that one will have the faith to go through whatever comes before one.
Okay, thank you. Bishop Burke? Bishop Burke? I think you might be muted.
Oh, I'm very sorry.
Okay.
I'm hoping you're hearing me now.
Mm-hmm.
Okay.
Can hear you now.
Right. So I say good evening to Barbados and to all those who are watching with us. Good evening, Peter, and good evening to this distinguished panel. I'm interested this evening in the discussion primarily around the fact that, as my colleague was now saying, we are people of faith. And the interesting thing about being a person of faith is that, unfortunately, if you are a person of faith, that faith will be tested. We know that that there are persons who have been going through some severe challenges at this point in time. We are aware that there are some persons who have had it extremely tough, persons of faith. And I don't think that COVID has determined who who will be the recipient of this onslaught. So persons of faith have been isolated, persons of who are not of faith have been isolated. Every single person has experienced at some point in time, or has been a part of, or knows someone who has gone through the tough period. So this evening, I am interested to be able to continue that discussion concerning our faith, because I think that one of the things is that our faith is oftentimes built through these difficult times.
Okay. Pastor Peters, we're going to ask you the same, and then we have a caller on the line. So go ahead, Pastor Peters.
Okay. Well, good evening to the Barbadian public. Good evening, Peter. And to the rest of the gentlemen here, good evening to you. In terms of the discussion, and I'm very happy with where it's going, because we introduced faith. And one of the follow-ups from last week is somehow it was misinterpreted that when I spoke that and said that COVID is not an issue of faith, but that it's a medical issue or an issue of choice. Some persons might have misinterpreted. I know the panel didn't, but the context in which I was speaking, I just said, let me take this opportunity to clear this up, because when I'm speaking of faith, I'm not speaking of whether or not we believe that God has the power to heal, or God has the power to protect us and preserve us. When I'm speaking of faith, I'm speaking from the standpoint of my observation that it has become a sort of a judgment based on whether you take the vaccine or don't take the vaccine, and there are people people are casting judgments on each other on each other. If you take it, you've lost your salvation. And I'm speaking in the context of a relationship with Christ, faith in Christ. And I would like to say here unequivocally that whether you take a vaccine or you don't, it has nothing to do with whether you're still a child of God or not. And it is just simply another way in which we are not embracing an opportunity to come together. Rather, we are allowing this opportunity to further create divide and create arguments. But I believe there's a great opportunity here for people of faiths and other faiths to be able to come together and speak, such as tonight, and I applaud this. Thank you.
Thank you. And we have a caller on the line. We say good evening and welcome.
Hi, good evening.
Good evening.
Hey, good evening, Peter. How are you doing?
I am well, thank you so much for asking. I hope all's well with you.
Yes, please hear me, Lord, and good evening to all of the pastors and everybody else out there. I hope that the powers that be you will be persuasive in having a part 3 to this part 2. Okay, we are, as the pastor said, we have to be in faith and believing in faith. So, faith without works is dead. So we're hoping that would happen. I want to ask the panel just one or two questions. Number one, now you would have heard and would have understood that some churches weren't observing the protocol. I want to ask the panel those two questions. How do you all feel or felt about that? Do you see it has nothing really to do with faith? It also has something to do with using also common sense along with your faith, right? So a lot of people, you would understand, misinterpret or take the word faith out of context and use it to suit them. And number two, what are the church's views on mental health? You would understand in this COVID environment, this COVID fatigue, and I don't think that the issue of mental health is really vigorously dealt with enough. So I would like to really hear from your pastors there. And what is your feeling? What can we do to arrest this issue of mental health? Because it's having a strain on mainly a lot of young folk and some aged folk as well.
Thank you so much, sir. And actually, it's quite prophetic because especially Bishop Burke, I know that has been one of his concerns that he would like us to tackle tonight as well, the whole idea of mental health. And so thank you for that. But gentlemen, I'm not sure who would like to to go first on this one regarding the church observing the protocols? Not
like
all at once, you know.
I would like to speak on the mental health issue.
Okay.
The mental health issue, because one of the concerns I've had from the very beginning of this pandemic is that I believe we are going to manage the pandemic in terms of our protocols, in terms of the professionals that are involved. But the pandemic is going to leave with us a lasting impact. And because it has affected our way of life. And, you know, with churches, I do know many of our churches and many Christian organizations do have counseling. The question is how many people are making use of that counseling. You know, we have our Soul Care Center. I do know Heartbeat International has theirs as well. Reverend CLARKE and others that would have those facilities. And I think it's important that it be stressed to our people as well, Christians, that we do need to have that kind of intervention. One of the most telling ways, and I'll be very brief with it, is in the way we are made to grieve. We are forced as a community that have been accustomed to grieving in a particular way. Now we are forced to grieve in a different way, not being able to see our loved ones and all of that. You speak of the other islands and the kind of things that are affecting them, and it's going to have a lasting impact. And my concern is, when we come out of this, will we be a healthy people emotionally and psychologically? And I believe we have what it takes to be able to help that and prevent the lasting impacts.
Okay. I think that one of the impacts, though, that we certainly have to deal with is what he asked first, and that is the impression of many that there were some churches who have been observing the protocols and some who haven't. And you've got to deal with it, you know, and that's what the feeling is. And so what are your thoughts on that? You know, not glossing it over. That's what some people feel. Bishop Burke?
And I'm glad that you're saying, Peter, I'm glad you're saying that it is a feeling.
It's a feeling,
because
it's an
there
impression.
is a difference, right? There is a difference between obviously the feeling and the fact. One of the things that I noted very early in the entire discussion concerning this whole thought is that several persons seem to have thought that the church was just out there not wearing masks, just going to church, just praising the Lord and misbehaving themselves, and you know, and enjoying themselves and acting as though there was no scientific value to COVID, that COVID really and truly could not affect us, that we were somehow immune against COVID. And that is the furthest thing from the truth. In fact, I was in 2 meetings where I heard both the Minister of Health and the head of the COVID unit attest to the fact that even before many other entities had their protocols in place, before many other entities started to set up certain structures to ensure that they would protect their workers, the church had come out and had already met with the Ministry of Labor under the third sector, and the church developed protocols, submitted the protocols. In fact, in some cases, we were even under more stringent protocols of our own making than what would have been shared. So we put certain things in place, and we had already taken it seriously. I want to make a statement here. I have a good friend who says it this way, and it is something that we embrace as a church. He said that the Apostle Paul had enough faith to believe in healing. So he had enough faith to believe in healing, but he also had enough wisdom to believe in the science. And if we know anything about the Apostle Paul walked with the Dr. Luke. So the church is not in any way against the science. There may be, like any other entity, there are fanatics, but the church is a microcosm of society. And what would have happened in some cases is COVID is all around. It's rampant in communities. If someone comes into the church, they're asymptomatic, and now we're recognizing that is a greater challenge than we thought in the initial stages. persons are asymptomatic, they come into the fellowship, and unfortunately they pass it on to someone else, and then it spreads because we are all a community. So I would want to disabuse anybody of the belief that the church and other faith-based organizations are just out there misbehaving and spreading COVID worldly, because you're seeing it in the social media, you're seeing it on all the posts and everything, and people are acting as though we are just being irresponsible.
Okay.
We are in the forefront pushing this thing.
Okay, thank you for that. Not going to leave it though, because I have a comment to pass on that, but we're going to just take a quick break. We're past the time for our first break, but when we come back, we will continue, because SULEIMAN, I realized that you wanted to jump in there. So, all right, we'll do that after the break. Part two of COVID-19's impact on faith. And SULEIMAN, before we went to break, I think you wanted to be part of the discussion before the break.
Yes, Peter, and I just wanted to add that for the mosque, the established mosque on the island from day one strove to implement the protocols that were put in place, and the social distancing, the mask wearing, and so on. And I think by and large, the main mosque established that. But you, as you are aware, we are part of the society, and so you do have individuals who would come into the place of worship and want to not do what they're supposed to do. And so that became a challenge at times for the mosque administrators. And so you have that. It's not all angels that come to our places of worship. You know, sometimes you find the non-angels. But that is a challenge. And because it's wide, it's established in the society, there are people that don't want to wear masks, there are people that don't want to follow protocols. But the mosque administrators made sure that they put the things in place that was necessary. And the way that we operate is a little different than the church, because we don't have singing and so on. So the mask will probably be worn, and we cut down on the time of our services. We pray 5 times a day, so we have services 5 times a day, but we cut down on the time span that people spend together. So we did put things in place to mitigate against spreading the COVID in the established mosque.
The comment that I wanted to make, though, that was in all fairness and similar to what you were saying, that there are human beings who make up the church, you know, and each person or individual has their own biases and agendas, and so therefore the distinction sometimes has to be made, like we made it last week. Are we talking about the institution itself, or are we talking about the actual body? And so that's one thing. And then there's, for me, something I don't want us to go away from tonight without me asking. Like last week, I didn't get a chance to ask about the science, was the fact of the American church's impact on the local church and the conservative church, especially in the United States, which has seemingly some very strong opinions about the science or non-belief in it, and how has that impacted on us here in the island? Because when you speak of social media, many times you see the quotes and the views being passed that you would see mirrored in the American, church. So that's something that I would like to get through to, but I also want to take our viewers' comments. So we have some WhatsApp messages, so perhaps we can share the first. No, not yet. Oh, here we go. What confuses me most is that they spoke a lot, and this was from last week, about exercising faith. But you hear coming from the pulpit, you must trust the science. That is, have faith in science. Isn't that a contradiction?
If I can come in here.
Certainly.
Unfortunately, over the years, we have done this thing of separating out the various disciplines of knowledge. And one of the greatest separations that we've had has been theology or God-related matter and science-related matter. And perhaps a lot of that might have happened around the whole Darwinian theory of evolution, which seemed as though at one point in time it was challenging the creation story. And I think we have continually, those persons who have not been a part of the thinking, the real inside thinking, have heard those kind of little remarks and have continued to have this great divide. But in reality, the people of God have been the greatest scientists in the world from day one, because it was when I say the people of God, I'm talking about persons who devoted their time and their lives to understanding the world in which they live. And so it is because of them in the various cultures, whether it is among the Hebrews, whether it's among the Mayans, the reality is that persons who had this sense of an all that is, or an other being, have been trying to understand their place in the world. And that in itself is science. Science, and even within the context of this, you'll find that they have given to the world tremendous information about our world. And they did it because they were in search of God. So when we come to this point in time in our lives, and we're talking about this great divide, it's a divide that does not exist anymore, not in the real halls of science and theology. There's been such an understanding, and they're beginning to perceive the divine order in things, and their minds are being blown at times, and they're realizing at the end of the day, this has to be some kind of divine organization. It cannot be just haphazard. So the conversation about science, or it's a non-point. It has to be both, and you can't divide.
I think one of the things, and you mentioned it last week, is that people are now, the way that they think and disseminate information is a lot different. They don't accept things wholeheartedly anymore. They question, and we saw that from the question posed by the child, And in all fairness, I must state that the question that was posed was not, why does God allow things to happen to bad people? I think the question was, why does God allow bad things to happen? Sorry, not bad things to happen to good people. It was just bad things to happen. There was that was it. It wasn't bad people. It was good things happen, bad things. The question was incorrectly worded. Yeah. The question was, why does God allow bad things to happen? And that was the question. Yeah, so that was another one then that came up. So I think that we have to perhaps look at the way that people now interpret and disseminate information. And there's so much information out there, good and bad, which is available at the click of a mouse, you know. So this is why sorry, go ahead, Dr. Clarke.
I was just going to say that one of the challenges that we have is that there was a time when information was not available. It was kept away from persons. Right. And sometimes that is good, because sometimes when persons have information and they're not trained how to use it, they can abuse it without even thinking. And I think we are beginning to see a lot of that with social media, that persons are getting little pieces of information and they're sending it out there, and it's causing more harm than good. So again, what is required, what the church really needs to do at this point in time is the church has to be at the forefront. When I say church, I apologize, but the communities of faith need to be at the forefront of bringing back that divide, because that divide is not a realistic divide. It's a false divide. And I think what COVID has done for us is that it's created an opportunity when we can begin to look at the fact that there is absolutely nothing in this world that we experience that is separate. Everything interferes and everything interrelates with everything else. And that's just the reality. And we've got to be able to come to that understanding and don't think that life is about boxes. There's no such thing as boxes when it comes to life.
Okay, thank you. Pastor Peters, I saw you making a move to speak. Sorry. You're still muted.
Okay, sorry for that.
That's
Dr. Clarke preempted what I was going to say, because the reality is we are faced with more information than we've ever had in the history of the world. At the click of a mouse, you can find anything, and most of the time, let us be honest, people will gravitate to the kind of position that they're most predisposed to. And if one is already on the fence or leaning toward a particular persuasion, all they would need is some information, regardless of how reputable or credible the information is, to push them in that direction. So it's about us being able, and I think now is the time for us to really show the value of good research, and now is the time for people to be able to learn what to make good sense of, and what to follow and what not to follow, because there is so much out there. And as you said correctly, you can see it. You see it in the Facebook posts, you see it in the group chats, and people are posting things and asking and somehow trying to sway others. And it's all because information is coming. I believe in a particular thing. I have a particular persuasion where that is concerned. And whatever I get, I'm going to overload you. So it's about information overload, and it's working to our detriment.
We have
Peter.
a WhatsApp question. What are the churches doing about reaching out more to not only the homeless, but also those people in society that are having challenges with work?
I would want to jump in,
because I know we all do it. So so let's go.
Yeah, I would want to jump in here, Peter, and say that I don't think that the church and other faith-based organizations have ever stopped their mandate, which is the meeting the needs of those persons out there in society, the less fortunate, those persons who are struggling. I think that has always been the case. What we have found also within the last probably 2 decades is that there are also some para-church and para-faith-based organizations that have come on board, and they're still being supported by the church. So the church is still funding a lot of their programs, etc. And they're working with them. Within the New Testament Church of God, I can tell you comfortably that every single pastor, every leader of our churches they've been keeping their list. They've been making sure that nobody's left behind. So it isn't a case where this is something now that we are going to now start doing. The difficulty is oftentimes in scripture we are reminded not to allow the right hand to see what the left hand is doing and not to parade your arms before others. So we try not to, we're not going to make it a newspaper item. We're not going to put it on social media. We're quietly being a blessing to people, assisting families. And interestingly, again, the ministry of social development, I think it is, they have been reaching out to the church and asking the church to come on board with several of the programs and assist when things happened, when the hurricane came, but we were asked to come on board. So the church and faith-based organizations have been quietly making sure that there's nobody left behind in our communities.
What are the Muslim members within the mosque and so on? What message is being shared there, Suleyman? How do you leverage your platform?
Well, as you know, we've been involved in a number of charitable events and activities, and both at a private level, as was mentioned. You do what the right hand does and the left hand doesn't know what it's doing. But also, we try to do it as a way of showing the neighborhood that is around the mosque to try to assist those. So early in last year, early in the COVID program, we did a number of food hampers and had that happening, but that continues under the radar now. We also have a charitable fund that we have set up, which has been going for many years, that assists Muslims as well as persons of other faiths if they come in for the assistance, and that has been going. But we also have a challenge as well. I mean, many people are not getting the same income as they got before, so their ability to give charity is diminished as well. So that puts a burden on us as well as how much we can give. But we continue to try and give charity. Charity is one of the pillars of our faith. It is one that's highly recommended, especially also at times like these when we have challenging times, that we should give more charity. That helps to alleviate, and that message goes out regularly to the congregation to help whoever you can in whatever way you can, and we try to reinforce that constantly.
Okay, thank you. We're going to take another WhatsApp question after we take our break, as you're watching part 2 here on CBC Presents of COVID-19's impact on faith. Let's go back to one of the questions, the WhatsApp questions that we had pertaining to science. I think that Dr. Clarke wanted to take perhaps to answer that one. The what confuses me, am I right, Dr. Clarke? What confuses me the most is that they spoke a lot about exercising faith, but you hear coming from the pulpit the trust in science. Isn't that a contradiction?
Right. And while I would argue that it's not so much a contradiction, I also want to argue the fact that it is important for us to recognize that persons are not having a lot of faith in some of these large countries, because some of the things that are going on in some of the places in the United States that we're learning about, sometimes we learn about way after it occurred. Persons are beginning to have this kind of definition. They're not just following blindly because US says that, or Britain says that, or France says that. Persons are being suspicious of some of the things that are going on in large, especially when you find situations where ex-CIA agents are making confessions about the kind of things that could destabilize countries and peoples and organizations, etc. And I think that's a backdrop that we cannot let go. We cannot ignore that, because that's also a part of the reality of many of those persons who are choosing to take certain stance as opposed to others. So let's not just wash that away, because that's the reality, that some of the larger countries are involved in some things that we have not even imagined that they're doing.
Mm-hmm. Okay, that's an excellent point, actually. But again, it touches on the immediacy sometimes of the information that is out there. And perhaps one of the criticisms that can be leveled is that perhaps the church here is a little too quiet in response to some of the things which are coming out on social media. And if someone said that to you, how would you respond?
Well, you see, and I think this is one of the challenges we have here, is that sometimes the church itself is so occupied with matters of quote unquote faith that we're not always up there with some of the other dimensions. And maybe this whole experience is one to teach us that we need to be more concerned with a wider view of our world. Even things like something as simple as global warming. We're not hearing a lot of words from the church. We're looking at the fact that many of the various industries in Barbados, they're looking at solar energy. Our churches have all these rules, and we have not gotten anywhere with them as yet in terms of getting involved in this. Not saying that they're not interested, but these are some things that we're not always on the vanguard there with what's going on in the wider world. And I think maybe COVID is inviting the church to be a little bit more involved in some of the other dimensions of the journey in this world, and not just the journey beyond this world.
Gentlemen, I'd be interested to find out how you all respond to that as well.
Well, let me just share here that what is presented before us at the moment is an opportunity, I believe, for the church to transition in terms of even our leaders to become even much more rounded and much more comprehensive in their approach, and not just be simply, as we say, biblically minded, but understand, as Dr. Clarke said, that everything in this world is interconnected. And what I've found also is that that one-track operation has rendered us many times unable to really discuss pertinent matters that, yes, we speak faith, and yes, we speak of Christ and so forth, but there are some matters that really touch deep in human existence that we need to be able to connect with at times. And at times, even if leaders cannot, I do know that even within our various congregations, there are individuals there that have the kind of knowledge and expertise that can engage in those conversations. And so it is a call also, and we're all evolving through this COVID season into what the next phase of engagement would have to be. And I am seeing here, as a Christian leader, I am seeing an opportunity to be much more widely read, to really acknowledge some of the issues that we've been really passing over. I'll close with this. Even in my doctoral document that I prepared, one of the professors said to me that they've never seen anyone address the issue as Christian, addressing the issue really in that way of global warming and what we call earth cure of the earth. But we must look at it that way. We have allowed particular people of particular persuasions to somehow dominate it, and we have stood back. But if we really look at the world in which we live, we ought to be able to contribute and to engage in the conversation meaningfully and acknowledge at times where we've gone wrong.
Okay. Bishop
Yeah.
Burke, I noticed, and Suleiman, yes, both of you. Go ahead.
Yes.
Okay. I'm always excited about this because by profession, I'm also an educator. And so education matters to me. But what I have seen over the years, and I think that we might now be eating the fruit of it, kind of a demonization of higher education, demonization of anything. So it seemed to be as though anytime you try to educate yourself, it is going against faith. It is going against that walk of faith, and this education was really not meant for it. But one of the things that I have witnessed is really and truly that there is a space for the church, faith-based organizations around the table. I believe there's a seat for us. But because we have sidelined ourselves in certain areas, nobody is acknowledging, nobody is recognizing. And I think that things like this have given us now the opportunity to be able to come forward and let people know, listen, we can discuss the issues. We have positions on the issue. Recently, a couple weeks ago, Peter, we had a webinar series on vaccines and the church. And it is interesting to see that several of the persons who are actually right now in the forefront out there fighting the common enemy, many of those persons are people of faith. Many of those persons are members of churches. And we don't know it, but there are several persons who are medical professionals, etc., out there fighting this COVID fight. I think that we need to pause and acknowledge that the church that probably we knew probably 50, 60 years ago no longer exists. And as Eric said, we now need to start to reposition ourselves. We now need to start to see that we can offer value in other areas.
Okay, Suleiman.
Fellow panelists on this point, and I agree 100% with my panelists on this point. And I'm saying that what we are reaping now, as Burke said, was we are reaping what has happened years ago. We separated the church from the state. We separated faith from what goes on in the wider society. We rendered unto Caesar what is Caesar's and unto God what is God's. But we need to bring back together. We can't separate the two. The two are interconnected, as Reverend Clarke said, and we have to be able to be a force in the society that brings good. Everything relates back to faith, and we should bring faith into everything, and it should not be separated as we have it today. And so knowledge is there, and we need to use that knowledge and bring faith perspectives into that knowledge and into our society. And I agree, there are many people of faith that are part and parcel of what is happening in our society, and they need to come to the forefront. One of the things that we did a year or so ago, we were talking about information. A lot of information is out there, but there's also a lot of misinformation that is out there. And really and truly, fake news is an industry. And it's a big industry, and that's something that the faith communities need to be aware of, that fake news is a big industry, and we should let our congregations and our people know what is happening as well.
I think that, and I'm really sorry I didn't get an opportunity to write it down. One of the comments that came to me, person to person, our last discussion was, Peter, what about the hybrid faith-based individuals? And I said hybrid, and that was, yes, the people who have taken what they hear in the regular faith-based community and then have formed their own idea about what it is, what spirituality is. And I said, well, I don't think people have really and truthfully responded. And that was their concern, that they seem to be noisier than the ones who have the actual information. So the misinformation is being touted louder than the real information that's been behind the 8 ball and now playing catch up. So we're going to look at that when we come back. How can you all get around that now and get in front of those who are the proponents of the misinformation? And I'm speaking about religious misinformation when we come back. Just before the break, the question about the hybrid faiths, those who have, I don't know, perhaps kidnapped the original and made it now their own. Bishop Burke, would you like to touch on that?
Yeah, I would want to jump in, and I would want to say, yes, we have seen it. Again, remembering that COVID has not done anything to us, people of faith. It has done a whole lot for us. And what is kind of interesting is in this space, those persons have been using the social media platforms for many years. They've been getting out there, publicizing certain things. Right now, churches have found themselves, churches and faith-based organizations have found themselves right now in a similar space, because it's the way we communicate now. So the message is now being spread the way that they've been spreading their message. I think that there is a lot more dumbing down of their message. I don't know, Peter, if we are really meant to compete with them. I don't necessarily believe that. But I believe that as long as you share your message and you share your message consistently, the beautiful thing about the message that we are reminded in the scripture is that as long as that word goes forth, it will not return unto him void, but it will accomplish to the hearts that it is sent. And we don't need necessarily to become noisy in this space. And that is one of the things I think the church would need to guard against, becoming noisy in this space. But ensuring that as we share our message, it is clear, it is simple, and persons are able to understand, especially in this period, that it is a message of hope for all who need it.
Okay, I'm looking at the time and I can't believe it's there. And I know we have 2 WhatsApp messages. Can we see them quickly, please? A survey by Raw Research Center shows that congregations trust their leaders on whether to get the vaccine. Now I'm going to change these glasses. Have the leaders on the program encouraged their congregations to take the vaccine? Gentlemen? SULEIMAN?
I think that we have in our community both sides of the coin and some in the middle as well. So we do have those who will take the vaccine and advocate for it, and we have those who won't take the vaccine and nor advocate for it, and we have the vaccine hesitant. So they do exist in our community, and we are finding that.
Okay. And Pastor Peters?
Well, I have been very transparent where I am concerned. I have told our church that I have taken it, my family, we have done so. But again, as we have said before, the church is a microcosm of society. The members, they are privy to much information, and I don't think today that as Christian leaders we do have the kind of influence that we once enjoyed with our members, because many individuals, they have a lot of places where they can get the information from, and so you have individuals who would be swayed one way or the other. You have some that are anti and some are for. What I guard against is the whole issue of creating a divide between the vaccinated and the unvaccinated. Correct. We will not do that as a church. We will not do that. We're all children of God. We will not be creating any divide, any discrimination. That is not what the Word of God teaches us.
I don't know if I can ask you, Michael, Reverend Clarke, to give us in 20 seconds a final word.
Well, being at Codrington College, I don't have responsibility for accreditation, but generally speaking, the Anglican Church has been working with persons as well. And again, I support what everyone's saying, that one of the things we can't allow is discrimination or in any way to create division or change the status of anyone. There's no lower citizen and higher citizen. Right. They're all the same. And persons must be able to have the freedom to make certain choices. I don't support persons being penalized when they choose to not have the vaccine. I think we need to respect persons.
Thank you so much, gentlemen. Time has flown. Thank you for joining us again, viewers, for our part 2. And I certainly hope that it has cleared up some of the questions and concerns that many of you might have. And at this time, I'd just like, on behalf of the corporation, to, thank you for joining us. And gentlemen, please stay safe and stay well. And to our viewers as well, thank you for joining us tonight on CBC Presents. You take care.